According to the American Cancer Society, it's estimated 240 women will be diagnosed with cervical cancer in our state this year, and 70 of them likely won't survive the disease. Now, January is Cervical Cancer Awareness Month, and since it is treatable if caught early, it is important that we all know the facts. Dr. Brandy Shaw is with the Pacific Medical Centers here to get us up to speed, answer the questions that we all need to know about cervical cancer and awareness. First off, what is most important for women to know about cervical cancer and risk?
I think the most important thing to know is that it's highly preventable. So we have had a robust screening program here in the United States with pap smears for a very long time, so that now 40 years ago, when cervical cancer was the highest cancer for women, it's now one of the least.
I'm glad you brought that up because I know the guidelines have changed on how often women should be getting tested and screened. When should we?
So I think that this will come as good news to women. It used to be that women would start getting screened as soon as they had their first sexual encounter, and then for every year after that. In the last probably 5 to 8 years, we've changed the screening frequency to be every 3 to 5 years and not starting until you're 21, no matter what.
No matter family history?
No matter family history, and that's because young women, we've found, because their bodies are still changing and developing, they can often clear the infection that leads to cervical cancer, which is the human papilloma virus infection. So now it's ages 21 to 65 for routine screening every 3 to 5 years, depending on if you have pap screening or pap screening with HPV, human papilloma virus co-testing.
Okay, so what is the link with HPV and cervical cancer? Why are they connected?
So the way we think about it in the medical field is that human papilloma virus is necessary but not sufficient to cause cervical cancer. What that means is that almost virtually all cases of cervical cancer have human papilloma virus as the culprit that has caused the changes to the cells that lead to precancerous changes and then cancerous changes if they're not caught early enough. There are hundreds of different types of human papilloma virus. There are a few that we consider high risk that are more likely to cause precancer and cancerous changes in the cervix, and that's what we're trying to catch when we check your cells with a pap smear and by doing HPV co-testing at the time that we do a pap smear in some women.
And that is why they came up with the HPV vaccine, which they recommend at what age and why?
So currently the recommendation says to start at age 11 to 12 giving the HPV vaccine, though you can give it as early as 9 years old. It's approved for 9 to 26-year-olds, and it's for both young women and young men at this point. And starting at age 11 to 12, the rationale behind that is that because we know the human papilloma virus is sexually transmitted, we'd like to catch people before they're ever even thinking about having sex, which we assume for most 11 to 12-year-olds. So then they can get the full benefit of the vaccine series, and then by the time they get to a time later in their life when they are becoming sexually active, then they'll be at far less risk.
And do they just need one shot, or is it several doses?
It's several doses. So if you're 15 and older, it's a 3-shot series that can be completed within 6 months' time. And if you're less than 15, so 11 to 14, it is now a 2-shot series that can be completed in 6 months' time. And that's a new change as of the last year.
Okay, and I mentioned this as we started, that cervical cancer is highly treatable, one of the most treatable cancers if caught early. So these screenings are important. What else do you think is important people should know in terms of risk factors?
I think it's important for people to know that smoking has been a long-standing risk factor for cervical cancer because of the connection to human papilloma virus, which is a sexually transmitted infection. Having multiple sexual partners, not using condoms, can also be risk factors. And then for some women, it's a little bit out of their control, but women who are immunocompromised, already have a disease in their body that's making their immune system low, they can be more at risk for contracting cervical cancer as well.
Right. We got through a lot of important information. Thank you, Dr. Shaw. We appreciate your time.